Every single morning, your body hands you a medical report. It costs nothing. It requires no appointment, no blood draw, no waiting room. You just have to look down. Your urine color is one of the most direct, real-time windows into what is happening inside your kidneys, your liver, your hydration system, and your blood, and almost nobody reads it correctly. Here is the part that should stop you cold. Several of the most serious conditions that kill people over 50, kidney failure, liver disease, internal bleeding, aggressive cancers, all leave visible clues in your urine weeks or even months before any other symptom appears. Weeks, sometimes months. And every single morning, most people flush that information away without a second glance. If you want medical facts explained in plain language with no drama and no sugarcoating, subscribe and tap like right now. Let me be direct about something before we go further. This is not a video about drinking more water. You have heard that 1,000 times. This is a video about what specific colors, changes, and patterns in your urine are actually signaling, and which ones your doctor wants you to take seriously before they become a crisis. Because here is what most people do not understand. Your kidneys filter roughly 200 liters of blood every single day, 200 liters, through 2 organs the size of your fist. Every waste product your body produces, metabolic byproducts, drug remnants, cellular debris, excess minerals, gets sorted, filtered, and either reabsorbed or expelled through urine. When something goes wrong anywhere in that system, the urine changes color, smell, frequency, foam, clarity. Your body is not subtle about it. You just have to know the language. Color 1. Pale yellow. This is your baseline, your target. Pale straw yellow means your kidneys are filtering efficiently, your hydration is adequate, and nothing is obviously wrong upstream. Most healthy adults hit this color in the middle of the day when fluid intake and output are balanced. But here is what most people miss. Pale yellow in the morning specifically is actually less common than people think. After 6 to 8 hours without water, most people should wake up with darker urine. That is normal concentration overnight. If your first morning urine is already very pale or almost clear, it could mean one of 2 things. Either you drank water before bed, which is fine, or your kidneys are losing their ability to concentrate urine overnight, which is not fine. That loss of concentration ability is called impaired urinary concentrating capacity. It is one of the earliest measurable signs of chronic kidney disease, and it shows up years before your creatinine levels, the standard kidney marker on your blood test, actually rise. Most doctors will not catch this unless they specifically test first morning urine osmolality. Most do not. Color 2, dark yellow to amber. This is the color most people wake up with and most people ignore. Dark yellow means concentrated urine. Your kidneys are doing their job, pulling out waste and conserving water because your body is mildly dehydrated after hours of sleep. That is normal, but there is a line where normal concentration becomes a warning sign. When your urine stays dark amber throughout the entire day, not just the morning, your body is telling you one of several things. First, chronic dehydration. Not the dramatic kind where you feel thirsty and dizzy, the quiet kind where you are consistently 1 to 2% below optimal hydration levels. That level of chronic dehydration is enough to reduce kidney filtration efficiency by measurable amounts, increase the risk of kidney stones, thicken your blood slightly, and slow cognitive processing 1 to 2%. You will not feel dramatically thirsty. You will just feel slightly tired, slightly foggy, slightly slower. After 50, your thirst mechanism becomes less sensitive. Your brain starts registering thirst later than it should. You can be genuinely dehydrated and not feel it the way you did at 35. Second possibility for persistent dark amber urine, liver stress. When the liver breaks down old red blood cells, it produces a compound called bilirubin. Healthy livers process bilirubin efficiently and excrete it through bile into the digestive system. When the liver is under stress, inflamed, or beginning to fail, bilirubin backs up into the bloodstream and spills into the urine, turning it darker. The difference matters. Dehydration-related dark urine lightens quickly after you drink water. Bilirubin-related dark urine does not. That is a simple home test worth knowing. Color 3, orange. Orange urine is where you need to pay real attention. It can be harmless. Certain medications turn urine orange rifampin, an antibiotic phenazopyridine, a urinary tract pain reliever. High doses of certain B vitamins, particularly B2. If you are on any of those, orange urine is expected. But if you are not on those medications and your urine turns orange, especially if it stays orange for more than a day or two, that is a signal that needs a doctor. Orange urine not explained by medication almost always points to one of two things: severe dehydration pushing concentration beyond normal amber, or significant liver involvement where bilirubin levels in the blood have risen high enough to affect urine color dramatically. Here is the clinical detail most people never hear. When orange urine appears alongside pale or clay-colored stools, that combination is a specific red flag for bile duct obstruction. Your bile duct carries bile from your liver and gallbladder into your intestines. Bile is what gives your stool its normal brown color. When that duct gets blocked by a gallstone, by inflammation, or in serious cases by a tumor, bile cannot reach your intestines. The result: pale stools, orange urine, and often yellowing of the skin or eyes starting to appear within days. That combination is a medical evaluation, not next week, not after you see if it clears up, that week. Color 4, pink or red. This one stops people cold. Pink or red urine is blood in your urine until proven otherwise. The medical term is hematuria, and it splits into two categories that matter enormously. Gross hematuria is blood visible to the naked eye, urine that looks pink, red, or like diluted cola. Microscopic hematuria is blood only detectable under a lab microscope, urine that looks normal to you but contains red blood cells. Gross hematuria is something most people notice and most people panic about. Here is what they do not always know. Painless gross hematuria, blood in your urine with no burning, no discomfort, no fever, is one of the classic early presentations of bladder cancer and kidney cancer. Painless. People see blood, feel no pain, assume it will pass, and wait. Sometimes it does pass because tumors bleed intermittently. They can bleed today, stop for 3 weeks, bleed again. That stop and start pattern is what makes people think it resolved itself. It did not. Urological guidelines are extremely clear on this point. Any episode of gross hematuria in an adult over 40 warrants urgent evaluation, even if it resolves on its own, even if it only happened once. Onsen. There are benign causes too: kidney stones, urinary tract infections, heavy exercise, certain foods. Beets and blackberries can turn urine pink temporarily. But none of those explanations should come from you. They should come from a doctor after evaluation. Brown urine that looks like dark tea or cola is a distinct warning with specific causes. The most serious is a condition called rhabdomyolysis. When muscle tissue breaks down rapidly from extreme physical exertion, a crush injury, certain medications, or severe dehydration, it releases a protein called myoglobin into the bloodstream. Myoglobin is toxic to kidney cells at high concentrations. The kidneys try to filter it out, turning the urine brown, but in doing so, the myoglobin can physically block kidney tubules, the microscopic filtering channels, and trigger acute kidney failure within hours. Rhabdomyolysis is not rare. It happens to people who start intense exercise programs too aggressively. It happens with certain cholesterol lowering medications, statins, in some patients. It happens after prolonged immobility or severe illness. If you ever have cola-colored urine following intense physical activity, significant muscle pain, and feel generally unwell, that is an emergency room situation, not tomorrow, that day. Brown urine also appears in certain liver conditions and with some medications. Context always matters. But cola-colored urine with muscle pain has one message: get medical help now. Cloudy urine and foamy urine are two different signals. Most people confuse them. Cloudy urine, white, hazy, murky, most often means one of three things: a urinary tract infection, where bacteria and white blood cells create visible turbidity in the urine. Kidney stones, where mineral crystals make the urine appear milky or hazy. Or in some cases a condition called chyluria, where lymphatic fluid leaks into the urine, which is rarer, but signals significant lymphatic or kidney disease. Foamy urine is different. An occasional bubble when urine hits the water fast is normal physics. Turbulence creates foam. That means nothing. Persistent foamy urine, foam that stays, bubbles that do not clear after a minute or two, is a specific warning sign. It indicates protein in the urine. The medical word is proteinuria. Healthy kidneys do not let large protein molecules pass through their filters. When protein appears in significant amounts in the urine, it means the filtration barrier is damaged. Proteinuria is one of the earliest detectable signs of diabetic kidney disease. It also appears in hypertensive kidney damage, in autoimmune conditions like lupus that attack kidney tissue, and in a serious condition called nephrotic syndrome. Here is the critical point about foamy urine that every person over 50 needs to understand. You can have significant proteinuria, enough to indicate real kidney damage, and feel completely normal, no pain, no fatigue, beyond what you attribute to age. Nothing. The foam is the only visible sign, and it shows up years before kidney function measurably declines on a standard blood panel. Years. If your urine foams consistently, that is a conversation with your doctor. Ask specifically about a urine protein to creatinine ratio test, not just a standard urinalysis. That specific test. Here is what changes the entire picture after 50. Your kidneys reach peak function in your late 20s. After that, kidney function declines at roughly 1% per year. By age 50, most people have lost somewhere between 20 and 30% of their peak kidney filtration capacity and feel absolutely nothing because kidneys have enormous reserve capacity. They compensate, they adapt. They keep your blood values normal even while quietly losing functional tissue. This is why standard blood tests often miss early kidney decline. Your creatinine looks normal. Your eGFR looks acceptable. Your doctor says your kidneys are fine, but the reserve is shrinking. And that shrinking reserve means the same insults, dehydration, an NSAID painkiller, a contrast dye for a scan, a bout of severe illness, that a 30-year-old absorbs without consequence can push a 65-year-old into acute kidney injury. Your urine is reporting on that reserve in real time every single morning. That is why paying attention after 50 is not paranoia. It is basic, practical medicine. So here is exactly what to do starting tomorrow morning. 1. Look before you flush. Make it a 3-second habit. Color, clarity, foam, every morning. 2. Track any change that lasts more than 2 consecutive days. Color shifts that resolve in 1 day after drinking water are usually hydration. Changes that persist deserve attention. 3. If you see pink, red, or color-colored urine, call your doctor that day. Do not wait for it to resolve on its own. 4. If your urine foams consistently, ask specifically for a urine protein to creatinine ratio, not just a dipstick urinalysis. That specific test. 5. If you notice orange urine alongside pale stools or any yellowing of your skin or eyes, that is urgent medical evaluation, not a wait-and-see situation. 6. Bring your observations to your doctor as data. Write down the color, the time of day, how long it lasted, and what medications or foods you had. Doctors make better decisions with specific information than with "it looked weird." Now let me ask you something directly. How old are you? Because after 50, after 60, the same urine change carries a different weight. The reserve in your kidneys, your liver, your vascular system is different. What your body can compensate for quietly gets narrower with every decade. Write your age in the comments. I read every single one, and it helps me understand exactly which part of this material lands closest to where you are right now. Your body has been sending you this report every single morning of your life. Most people never learned to read it. Now you know what pale means, what amber means, what foam means, what red means. You know which ones are wait and see, and which ones are call today. That knowledge costs you 3 seconds every morning, and it could be the difference between catching something early and finding out too late. If this gave you something real, subscribe and tap like. That is how Dr. Elara Whitefield reaches more people who need this kind of honest, clear medical information.